Drumroll, please. Autism is caused by not Tylenol. Let's talk about it. Dr. Hassan-Ali here, double board certified pediatrician. I don't need to belabor the point, but Tylenol or acetaminophen doesn't cause autism. You've heard it by several pediatricians, family doctor, obstetricians, gynecologists, and other medical professionals on social media about this. I think for me, I do a lot of advocacy work, and there's two things that I wanted to highlight. One is women's reproductive health. So there seems to be this ongoing sentiment about oppressing and stigmatizing women or people who are becoming pregnant. It's really important to support these women during this process, which includes pain management and also managing other symptoms like fever and some discomfort. We have to continue to advocate and support these women to make sure that they have healthy and successful deliveries so that both they and their incoming child are healthy together. I'll link below some position statements from the American College of Obstetricians and Gynecologists, as well as the Society of Obstetricians and Gynecologists of Canada. Please take a look at them. These are affirming statements about the safety of Tylenol use during pregnancy and how we can make sure that we avoid miscommunication and misinformation. If you have any questions or concerns, those are really good places to start. Number 2, autism is here. So instead of talking about how we can get rid of it, stigmatizing it, and cornering children who have these conditions, let's talk about actually how to support it and how to make sure that we have the best achievable outcomes for these children. So how do we support these children? Well, we need to make sure that we have funding in autism care. Things like having behavioral therapists, nutritional therapists like dietitians, physical therapists, occupational therapists, educators. All of these things are very important in terms of making sure that we understand how significant the severity of autism is in a specific child and what we can do to make sure that we help support them grow and develop. We also need to put more funding in terms of tools that parents can use on a day-to-day basis at home, including supports and equipment. And we also have to put funding towards educators, especially when these children go to school, what type of resources, technology that they need. So how can you get involved in supporting women who require medication during pregnancy as well as autistic children? Talk to your governor, write letters, campaign. If you're in Canada, talk to your member of parliament. Your voice does actually matter. If you can put a celebrity like Jimmy Kimmel back on TV, it means that your voice actually can make significant strides as well in healthcare research and healthcare medicine in general. If you live in Ontario, I'll link below the Pediatricians Alliance of Ontario. It's a great advocacy site where you can find some templates as well as who to contact if you have any questions or concerns or wanting to voice your opinion.